All right, what is up, everyone? So, just a quick preface, I guess, before the actual video starts. I just want to say I'm like really bad at these videos, and you could probably hear like a bunch of background noise right now. So sorry, like in advance, I guess. That's like the best way I can put this. This is part two, or well, not part two, but like video number two of the whole healthcare related problems, stuff like that. It might not just be healthcare related problems. I know last video said healthcare related problems, but in reality, it's probably just anything to do with like medicine. So we'll see. I'll just have to like come up with whatever the next video is. Yeah, that's all I have to say. And also, sorry for being so like terrible at Valorant. I like have no other game that I'm playing right now, so I just decided to use this as like background video. So yeah, enjoy. A lot of you may know what the leading cause of death is in America, but for those of you who don't, say hello to heart disease. An article by US News puts heart disease at the top of the food chain when it comes to the leading cause of death in the United States. Heart disease is a very broad term that can honestly refer to a lot of different things, but among them is coronary heart disease, which is caused by plaque buildup in arteries. If left untreated, this may lead to a heart attack. Fun, right? Now let's say your name is Gerald. You're a 52-year-old man who owns a logistics business that transports precious metals across the globe, so money really doesn't become an issue. However, your health definitely is. Due to a poor lifestyle, your bad cholesterol levels have been reported to be quite high, meaning that your doctors prescribed you a drug called atorvastatin. It's meant to help lower this amount of bad cholesterol so that your chances of suffering a fatal heart attack is reduced significantly. You go to the pharmacy, and since you have the best health insurance that money can buy, you pay a meager amount for this drug in comparison to others. Without any sort of health insurance, the total cost of this drug per prescription is about $40. What's crazy is that this number is just going to keep going up and up. For it being the most common prescription drug that's given to people in the United States, $40 per prescription is a lot of money considering that the drug itself is generally to be taken once a day via pill, and assuming that it's maybe 40 to 50 pills per bottle, those costs add up over the course of just a few months, and for a year, that's a lot of money spent, even if you do have insurance. However, insurance isn't some indestructible shield that's going to protect you. It's already pretty bad that a common prescription for lowering cholesterol level is already high, but prescription drug prices are already increasing. According to an article from Healthcare Finance, the price of prescription drugs has risen 35% from 2014, whereas all other commodities have risen about 19%. Looking back in 5 years, this number may rise to 40%. The increase in cost of drugs is in fact higher than the increase in the average hourly wage from the same time span of 2014 to 2022. This poses a problem that shouldn't be ignored. Why aren't we able to afford drugs needed to survive? From a report provided by the Commonwealth Fund, it says that 1 in 4 adults worry about the cost of prescription drug costs in the United States. A lot of cases are extreme to the point where many people will not even take their full prescription. They'll essentially ration their amounts, allowing their condition to possibly worsen because they aren't able to afford the next prescription. So you might be wondering why I say that healthcare isn't an indestructible shield. Well, if drug prices go up, that also means health insurance premiums will also go up, along with the cost of our out-of-pocket payments. The meager amount that Gerald was paying is probably going to keep going up and up. Now imagine those who don't even have that good of a health insurance plan, and they already pay a hefty amount. Definitely not a scenario that I would want to see myself or anyone else in.
Nope.
Just to make sure that it's clear, these are problems that are found in America. Now let's take a look at a country like France. With it being one of the most impacted countries during World War II, that means that they had to rebuild their country, including their own healthcare system. To simplify things, everyone that lives in France has to pay for health insurance. Basically, it's social security. Almost 50% of the coverage is from payroll taxes, and about 33% from income taxes. That's a big word here, taxes. That's not to say that taxes are the sole life support for the country's healthcare coverage, but it certainly is a large amount. But what's offered is extremely good. People who fall into a low income bracket or are suffering from something like a long-term sickness have their care 100% covered. And about 70% of a visit to the doctor or general hospital cost is covered by insurance. They cover things like long maternity leaves, medical transportation services, diagnostic tools, even homeopathic medicine. Like what? So there's probably two words that may be coming to your mind right now, and for those of you who don't know what I'm talking about, it's socialized medicine. It's typically the number one thing that I hear people say when it comes to a lot of European countries. In the case of France, it's actually a combination of both government and private services that offer excellent coverage for the people of France. Now let's explain the United States healthcare system a bit more, since all we really talked about was how the cost of drugs climb. To put things into a really summarized version, the USA doesn't offer universal coverage. A lot of Americans have employer-provided insurance, meaning that's provided to you because you work for a company that provides that. Medicare is typically for the old and disabled, and Medicaid is typically for the poor. Despite a lot of Americans having some form of coverage, it does not always cover everything, and the payments that are made by policyholders might be a bit high. That's why a lot of people hear the stories of people who get injured and say, "Don't call an ambulance, that's a lot of money I can't afford." Surprisingly, so much money goes into healthcare spending. According to a report from Health System Tracker, the United States spends about 19% of their GDP on healthcare. So with such a significant amount of spending on healthcare, why is the USA not even in the top 10 when it comes to the best healthcare worldwide? To better understand why it's on the top 10, let's just go back to the France example. As great as it sounds, it does have a fair share of problems that aren't as talked about. When looking at what France has to offer, one big problem arises from affordability and, in turn, accessibility. Take, for example, the protests from French medics during the COVID-19 pandemic. They demanded that their salaries be raised in public hospitals. The article from AP News claims that the years of cost cuts have already led to medics being unfairly paid. But even worse is that the COVID-19 pandemic has impacted public hospitals so badly to the point where emergency room services had to be cut. To a lot of us back in the States, doctors not being paid isn't exactly something we hear that often. After all, you do get paid pretty fairly based on the skills that you have. Well, for the most part. If I was a neurosurgeon, I wouldn't want to be paid just $50K a year for extracting a malignant tumor from a 58-year-old Army veteran. Sure, when you're being a doctor, you shouldn't really have pay as your primary goal. But it does when it comes to talking about the amount of money that's invested into a specialized education, along with the skills that are taught to you. The problem that we face here in America is that the care is too expensive. In a lot of Europe, the problem is that things aren't necessarily accessible. In the past, there have been a lot of protests about the accessibility of drugs. The problem with a lot of European countries and the system as a whole is that the approval and distribution of drugs is the primary buffer that causes a lot of uproar. One of the reasons behind this is due to a rather decentralized method of approval. The USA has the FDA to approve the drug, but the European Union as a whole requires that the drug gets approved through centralized and decentralized states. This leads to things being held up a lot, as it's not as easy to get it out everywhere. This could also be a big reason why we see that the United States is typically the pharmaceutical industry's #1 location when it comes to selling their products. You see, the process of getting drugs out in the United States is simple. The FDA will test a drug if it's safe, and then it's approved for it to be sold. It's really just that simple, and that's why a lot of pharmaceutical companies typically sell their drugs in the USA at a much higher cost in comparison to other countries. In most other nations, including Europe, the drug has to be tested if it's safe. Then it also has to go through a process of seeing if there are any other drugs that are similar to it. Then a price has to be negotiated for it, typically a bulk amount. It's important to keep in mind that the pharmaceutical companies are looking to make profit, so with the USA's rather simplistic process, it's a place where they can make a lot of money. Well, that about wraps it up for this video. I hope you guys liked the second video. I plan on coming out with another one in about a week or so look forward to that.